Health and Care Minister Gemma Arias Vasquez began her budget address saying that for her it was about the people and the real-life stories behind them. She said she kept hearing the system feel slow and had made it her mission this year to start joining the dots.
Between departments, between services, between the issues that people live with and the decisions that we make as Minister. Because, Madam Speaker, I do not want to be a minister who sits behind a desk signing documents. I want to be the kind of minister who rolls up her pink sleeves and gets things done.
The minister began her address focusing on the Care Agency, a department which had ended the year £14.5 million over budget. £6 million of these were part of a £10 million settlement of an incident in the Dr. Hiraldi home in 2013. Ms. Arias Vasquez said the main area of growth was an increase in looked-after children and domiciliary care hours. On the latter, she apologised for the structural and systemic problems with Lifecom Care and how families and carers had had to endure a difficult transition to community care domiciliary services. She said they were working not only to rebuild a service, but also to rebuild trust.
But let me be clear, CCDSL did not walk into a well-oiled machine. They walked into a service in disrepair. There was no proper handover from Lifecom. No rotas, no timesheets, no leave data. And yet, Madam Speaker, CCDSL and the Care Agency rolled up their sleeves and got on with it.
As part of improvements to the residential provision for adults with learning disabilities, Ms. Arias Vasquez announced changes at the Dr. Hiraldi home, with service users to be moved from the first floor to a refurbished building next to Tangier Views. The minister moved on to Procurement and Business, also part of her portfolio. She spoke of initiatives to make doing business easier and revealed business licence applications had doubled.
These aren't just statistics, Madam Speaker. These are real ideas with real people behind them offering real jobs to our sector. The online application form for business licence has been extremely well received. There are further improvements to the business licensing platform that we have rolled out to automate messages and to automate payment receives, and there is more to come. We are also looking to make changes to the non-licensable registration that is currently open to all types of services.
She also revealed the Office of Fair Trading would be rebranded the Department of Business, which will continue with the same functions as well as expanding to offer new services. As Minister for Public Utilities, Gemma Arias Vasquez announced Aquagip had spent almost £16 million on maintenance and improvements to the potable and seawater supply and sewage systems. She reported the company had secured £1.3 million from the insurance for the Powers Drive tunnel fire, 99% of its submitted costs. Moving to town planning, the minister told Parliament the department had received around 560 applications in the past year, with an estimated construction value of £478 million. Almost £1 million was generated in application fees alone. The new development plan, she said, is expected to be ready by late summer next year.
And let me say this clearly, as I have already said publicly before. The development plan is not a tick box exercise. It is an opportunity to shape the Gibraltar that we want to see. A forward-looking, confident and sustainable Gibraltar that builds with intention and purpose. It is about understanding where we came from and where we want to go, just as a 1991 plan helped shape modern Gibraltar by setting out our vision for the Finance Centre, the West Side Reclamation and key infrastructure. This new plan will define how Gibraltar develops over the next 10 years.
Health was kept till last, with the minister starting on shifting the focus from illness to prevention, with measures to help a community stop smoking or to tackle drug and alcohol abuse, as well as examining root problems. She announced 3 very early cervical cancers had been picked up by the new screening system. Gemma Arias Vasquez revealed the results of a survey on screen time among 78% of students in years 7 to 13. 12.5% scored above the risk threshold for social media addiction. And she said it was not just about the time on screens, but the problematic behaviour linked to it.
By year 13, nearly 100% of students use smartphones. Almost half use their phones within 10 minutes of waking up on a school day, and 1 in 4 uses a screen until the moment they fall asleep. Over 65% of adolescents believe they have no parental controls on any of their devices, and 27% of students say their parents know little or nothing about what they're doing online.
Emphasising the benefits of cohesion, a bill will soon be published bringing the GHA, the care agency and ERS together, which will change how they interact with each other. The reforms and restructure, she said, would protect independence, enhance transparency and deliver better outcomes.
The GHA will stay focused on clinical healthcare, the care agency will keep delivering social support, and ERS will continue caring for our elderly.
The Minister told Parliament an internal audit department was not only having an impact on cost control, but on service quality.
Because whilst we've been restructuring at the top, we've also been delivering at the front line. We're seeing more patients, performed more operations, reduced waiting times, and modernised how care is delivered.
Another measure here has been the establishment of an older people's medicine team with a geriatrician looking after the elderly. Waiting times for surgery has been reduced from 22 weeks in 2022 to 8 weeks, from 40 weeks to 5 in orthopaedics. Over 4,000 surgical procedures were carried out last year. Appointments availability at the primary care centre increased by almost 6%, with almost 153,000 appointments offered. And primary care, she said, continued to be a priority for her ministry because when it works well, the whole system works better. On elderly residential services, the minister spoke of the new management structure implemented at Mount Alvernia. There was reference in her address to industrial unrest within the GHA, with Gemma Arias Vasquez saying they were taking all claims seriously. She acknowledged the system wasn't perfect, but said they were moving in the right direction.